So if y'all have any questions, feel free to call us. We expect it, especially after today's visit in this class. You're going to go home, you're going to look over this workbook, you're going to read it cover to cover, you're going to use it like a workbook, mark in the margins, use that note page on the back, make sure every question gets an answer, okay? And then bring that book back with you the day of your procedure, because they continue to use it as a teaching tool. So in today's visit, they did your history, they did your medications, they told you what to take, they told you what to hold, they gave you a little bit of an idea about what to expect, and I'm going to finish that up. So after about 24 hours, all your lab results are back. Your chart is put together in a nice little packet, and it's sent to anesthesia for review. Whenever anesthesia looks over your chart, if they have any questions, any concerns about your results, they're going to reach out to your surgeon. If that changes any plans for your day of surgery, your surgeon's office is going to call you, and you're going to go from there. Otherwise, don't think anything about it. Our nurses in same-day surgery will be reaching out to you one working day before your surgery. I don't think anybody here has a surgery on a Monday. But one working day before your day of surgery, they're going to reach out to you and tell you what time to come in. And those arrival times occur sometime between lunch and 4 p.m. It depends on their census. When they tell you what time to arrive, you're going to talk about some Gatorade. Everybody usually already knows that they have to drink Gatorade. There's a school of thought that we subscribe to. It's called ERAS, Enhanced Recovery After Surgery. Everybody's got a handout that I gave them on this. It's just the idea that if you can go into major surgeries like total joints, bowel surgeries, things of that nature, and you can be as hydrated as possible and you get a little boost of electrolyte, you do better, because we're asking you to get up right away. We're asking you to get moving. We're asking you to do exercises and things like that. So the Gatorade helps that. Who here is a diabetic? Nobody's a diabetic. Okay, great. You can have any kind of a Gatorade you want. Just stay away from anything that's red or purple. And a 20-ounce bottle is all you need. Pick that up, put it on your grocery list, and then wait for same day to call you, and they'll remind you what time to drink the Gatorade. Now, you're not going to be drinking anything of any volume within 3 hours of your arrival time. That's due to anesthesia safety reasons. And the only thing I want to say about Gatorade is don't lose any sleep over Gatorade. If they call and tell you to be here at 6 a.m., guess what? You're going to drink that Gatorade before you go to bed. I don't want anybody getting up at 3 o'clock in the morning drinking Gatorade, okay? So just take care of it before you go to bed, if it's an early time arrival. The copy of your instructions that you got from today's PAT visit, keep it handy, stuff it in your book. If you have any questions, there's some contact information. You can reach out to us. Now, I want everybody to understand that the majority of your rehab and recovery from this procedure happens at home, on your own. It's important that we prepare for this. Our time with you is about that much, considering your recovery. So when everybody leaves here today, I want you to go home and look around. And imagine yourself scooting around on a walker. Everybody's going to be on a walker, whether you have a hip or a knee replaced. And your walker is just a little bit wider than your normal stance. So have a look at where you need to go. Everybody needs to go to the bathroom, the bedroom, the kitchen, the living room. Have a look. Make sure you're eliminating any obstructing furniture. Get rid of any clutter. Pull up any throw rugs that could get caught up in your walker legs and trip you. And if you have pets that tend to get underfoot, work on a containment plan for them, because you don't want anything to set you back like a fall because you didn't prepare for safety. So have a look at your house and where you need to go. And the other thing is, a big objective in this procedure is that you can kind of care for yourself. You're going to go home, you're going to be independent. You know, we want that. We want you up and moving, and we want you to be able to easily care for yourself, particularly in the first 2 weeks, which is that early post-operative period. So anything that you use frequently at home for your self-care, make sure that it's within easy reach, somewhere between your shoulders and your hips. So if your favorite coffee cup is on the top shelf, I don't know why anybody would put anything on a top shelf in my house, but anyway, if that's on, and you have to really reach, or if you have to, like, you know, make it easy, bring it all down. I don't want anybody to feel tempted to step up on a step or stoop down way low. It's just too early for that. So make things easy at home to care for yourself. The next thing I want you to think about is nutrition, and we already spoke a little bit about hydration. I don't want anybody to wait to be hydrated 3.5 hours before your surgery. I want everybody to start hydrating now. The more hydrated you are, the better perfusion your kidney and your livers get, and the quicker you're able to clear this anesthesia, the quicker your medication's able to be absorbed, and you're just much, much better. You're more efficient. So start hydrating now. I'm not going to take anybody's caffeine away. It's important. But when you think about hydration, think about water, think about other nutritious fluids. Don't try to build your hydrogenation on caffeinated beverages. So try to stay caffeine start now. The other thing I want to think about is food. You know, nutrition, it's the only fuel your body has to mend tissues and kind of get your strength back and your endurance. So nutrition's a big deal. So eat right. Anybody here diabetic? You said no. Okay, good. When you're thinking about nutrition, you know, most people have people around them, and everybody around you wants to help out. They just need a little direction. So if you live with somebody that can cook and help prepare nutritious meals, that's fantastic. Tell them I told them they have to cook. But if you are in a position where you have maybe church family, you have other extended family, things like that, people looking for a way to help, set them on task for some meal planning and meal prep. It'd be nice to have a couple of dinners of homemade meatloaf in your refrigerator or freezer that you can just pull out and heat and eat. So prepare for that. Most people end up taking a stroll down to the groceries frozen food aisle. There are a lot of very nutritious preparations that you can do in minutes so that you just eat and you still have good nutrition. So whatever it is, whatever avenue you're taking or calling out for help, make sure you're planning for good and healthy nutrition, and you'll need about 2 weeks worth of really convenient food items and nutritious meals, okay? The other thing I want you to put on your grocery list is a stool softener. Did anybody hear me say a laxative? No, it's really different. You just want a stool softener, okay? It's Colace, it's docosahexaene sodium. This is a preparation that you're going to be on while you're here in the hospital, because we're going to be giving you some pain medications that contain narcotic. And it doesn't take too many consecutive doses of narcotic pain medicines to do what? Cause some real plumbing issues. We don't want anybody to be constipated. We're not about causing problems, we want to prevent problems. So make sure you have some stool softener on hand, and make sure you're taking it like it's prescribed on the bottle. So that means if it takes 1 or 2 tablets twice a day, guess what? You're going to be taking 1 or 2 tablets twice a day. If your stools get too soft, you can always back off one of those doses. But the bottom line is you're preventing constipation, which is going to make you not feel bad and bloated and discomfort. You're going to be able to get up and get moving really quickly. You're going to feel better. So make sure you're preventing constipation. I want everybody to think about infection. It's official. You're all on infection control watch. This is a planned procedure. It's an elective procedure. I know everybody sitting here has needed a total joint replaced for months or years or however long we've all been putting it off. People do that. So make sure that you're looking and preventing anything that would slow down or delay your procedure, okay? So if you are at home and you've been doing good and all of a sudden you feel really fatigued, you've got a low-grade fever, maybe you've got a cough, you need to call your surgeon's office and let them know what you're experiencing. If you have a weird rash or some kind of wild abscess that's popped up and you're like, oh, that doesn't look too bad, it's on my unaffected leg, don't do that, because Dr. Bean's going to come in here the morning of surgery and rip that sheet back and say, what's that? See you in 2 months. So you just don't want any problems with infection circulating that could delay your surgery, because what happens is if your body's trying to fight an infection, it's already in your bloodstream. It's going to end up in your new joint. You're going to end up with a septic joint, and it's going to be a bad trip down a hard road. So be very transparent with your surgeon's office about any signs or symptoms of infection, any wounds on your skin that develop, anything going on like that. Make sure you let them know. The other thing I want to talk about is teeth and oral health. If you are somebody that has your own teeth, well, I don't know who else's teeth you have, but like say they're your original teeth. And we tell everyone to make sure you take a visit to your dentist's office. If you have any dental issues, they need to be addressed. Your mouth is full of infection. I mean, it's full of bacteria that can cause infection. So if you have any issues, any pain, tenderness, broken, sensitive teeth, make sure they're addressed with your dentist, because we don't want anything going on with infection through your oral cavity. So get it taken care of. No one here is going to be seeing a dentist within 3 months after your procedure because of the same thing. The risk of infection is too great. So know that after this procedure, you're going to be on like a dental hiatus for about 3 months. And then when you pick up the phone and you make your scheduled visit for your cleaning and checkup, say, hey, don't forget, remember in May I had a total joint replacement. And they're going to be like, oh, yeah, you're going to need to go by your pharmacy and pick up a dose of antibiotic because they're going to pre-treat you with an antibiotic before any dental procedure for the next year. Some dentists do it even longer. So expect that, and if you don't hear the right words, antibiotic before procedure, make sure you ask about it, okay? Does anybody here smoke? You're not gonna smoke at least 24 hours before your procedure. I'm not insensitive to nicotine addiction, therefore, that's an anesthesia mandate because of the increased risk of aspiration or pneumonia because smokers cough a lot when they're waking up, and it can just add some unnecessary inflammation to your lung passages. So no smoking or vaping for 24 hours before your procedure. We'd like you to stop right now, but we know that's not realistic for a lot of people. So you can use gums and lozenges. Just don't chew or suck on them after midnight the night before your procedure. And you can use a nicotine patch. That's okay to wear in the morning of surgery. Just let somebody know that it's in place, okay? Does anybody here have a metal allergy? Allergic to alloys like nickel or titanium? Anything going on like that? Okay, good. Pack your bags. You got everything picked up in your house. Everything looks good. You've got your grocery list made. What are you gonna take to the hospital? Everybody here, whether it's a hip or knee, typically will stay one night unless your surgeon tells you otherwise. Some hips go home, some knees go home at the end of the day. It just depends. So what do you pack? I want you to wear one outfit, pack one outfit of really loose fitting, really comfortable clothing. I don't want anything tight or binding around your hips or groin, around your knees, so leave the spandex at home. Something really comfortable. Make sure you're packing athletic type shoes, something that fits your feet snugly, something that has good traction soles. Don't come in here with open-toed or open-heeled shoes. All they do is wobble around on your feet and make you at a real high risk for fall. So something that's good and fits well. Skechers, boy, has their product line blown up. They've got all kinds of tennis shoes now with elastic tongues that you can slip on, which are really nice. It's the same purpose, so whatever you want. Anybody here sleep with a CPAP machine? Okay, good. We'll talk about that. So you don't have to bring any medicines. One change of loose-fitting, comfortable clothing with activewear tennis shoes, and you can leave that bag in your car until you get settled up on the total joint center in your family after they talk to your surgeon. After the surgery, you can go down and pick it up and make, You are going to have, everybody's got a walker that they're going to be using after the surgery. So your walker will be delivered to the hospital the morning of surgery, where you're going to be in 2 North. And if you already have a walker and you don't need a walker order, first it has to be the correct walker, and then you can bring it in the morning of surgery. The other equipment pieces that they might issue is a bedside toilet, which is like a 3-in-1. It can be used as a bedside toilet. It can be used as an elevated toilet seat, or you can take the whole kit and caboodle and put it in your shower for a shower chair. If you think you need something like that, reach out to your PAT nurse or the nurses in the office, and they'll make sure they write a note to your discharge planner to get it ordered, okay? Oh, we haven't talked about this yet. Everybody has a bottle of surgical soap. This is called chlorhexidine or Hibiclens. It is a medicated soap that we ask you to use before this surgery because it decreases some of the resident bacteria population on your skin, and it helps decrease your chance of surgical site infection. If you look on page 9 of your total joint book, and I've marked it, dog-eared it for everybody so you can find it, it says bathing instructions prior to surgery. Tells you how to use this soap. Basically, each and every shower that I tell you to take, I want you to take a shower with your normal soap and shampoo first. Then I want you to get a clean washcloth and wash with that surgical soap from your neck to your toes. I don't want anybody using this on their face. I don't want anybody using this on their private areas. It's kind of a strong soap. It has a drying tendency and it can irritate sensitive skin. And you're taking 3 showers with it. So rinse it off completely after you've washed with it. And after each and every shower with it, don't put anything on your skin. Now, if you look down here at the schedule grid on the lower left-hand side of the page, it says start surgical bathing. It's got a weekly grid, and it's got AM and PM. I have marked the date of everyone's surgery. And then when you look back, you'll see first, second, and third. And those are the dates and times that I want you to take your first, second, and third showers. Okay? After you shower with this surgical soap as directed and scheduled, don't put anything on your skin. No lotion, no deodorant. Everybody cringes when I say deodorant, but believe me, when you take 3 showers with that, as long as you're not like working, like you're not gonna, it's gonna be good. So no deodorant, no makeup of any kind, no jewelry of any kind. And ladies, have that pedicure, have that manicure, but don't let them put any color on your nails. The color of your nail beds is very, very significant for us. It helps us tell your oxygenation and your circulation. So no color on your fingernails or toenails. Make sure when you start your bathing that you're sleeping on clean, freshly laundered sheets. We don't want anybody sleeping with any pets. Pets spend a lot of time rolling around in stuff that makes them not smell like pets. That bacteria and dander gets in your linen, it gets on your skin, you just reset the clock. You're already at risk for infection. So no sleeping with pets. Ladies, maybe some men, don't remove any hair from your operative area with razor or with chemical hair removal. That can cause a microabrasion on your skin. It can open up your risk for infections, just like an injury. We don't want that. Let us worry about any issues with hair. I really doubt that you've all gotten this far without thinking about rehab, because rehab is the majority of your success with this surgery. So whether or not you've got a plan for rehab that involves outpatient rehab or home health care, whatever it is, make sure you have one. And if you haven't gotten one yet, start thinking about it, talk to your friends and relatives. And when you do know what you want to do, make sure you're reaching out to your surgeon's office. Because the day of your surgery, you have a discharge planner on your team, and she's going to be looking at those plans and kind of solidifying things. If you're using an outpatient therapy center, then she's going to make sure she has your first appointment for your evaluation made after your surgery, so you can go right to it whenever it's scheduled. If you are using home health, physical therapy, occupational therapy,
what is that?
Then
I'm
we'll be making sure if you don't have an agency that we help find an agency for you, and those appointments are made as well. So have a plan for rehab. And
I did have a question. You said the outpatient, and then the other one is the
in-home care.
In-home.
Yeah,
what is
home
that?
health.
What is home health?
They come in and give you
They're
your
nurses
therapy.
and therapists that come in your home and do your treatments.
Oh, instead of going to a site.
Yeah.
Okay.
A lot of people have different needs. Some people have transportation issues, some people have mobility issues,
Okay.
and going to an outpatient rehab center doesn't fit their needs.
Okay.
So we have to compromise and use home health.
Okay, home health.
Studies have shown that going to an outpatient rehab center is much more effective because, well, you have to get up, you have to get dressed, you have to get in your car, you have to go to this place, you have an appointment to be there. And when you get there, you're around a lot of peers that are going through the same thing that you go through. You get a lot of support, and you have access to a lot of different pieces of equipment and a lot of different primary or providers that are therapists, occupational therapists, things like that. So if you have any issues, you have a lot of access to them. So same thing with home health. It's just that you have people coming to your house. It's just that outpatient has, it's just more
So
stimulating.
it's a little limited, but not.
Yeah.
Okay.
Yeah.
Okay.
And then whenever everybody kind of starts rolling into their rehab, you have to be very committed to this. So that means if you have a plan to do certain exercises with so many reps, that's what you need to stick to. And if there is anything that stops you or holds you back, that needs to be communicated. You need to have a very transparent communication with your provider, because nothing stops progress like pain. So if you're having trouble doing some of these quadriceps exercises and you're like in the waiting area, you're like, do you do those quadriceps? I don't do them, they hurt. So I'm just not. You're going to be the person 2 months from now that's in our lobby waiting to have a frozen joint surgery. Because if you don't do, everybody's put together in layers. We're just like onions. So if you don't move this joint, the joint is going to be perfect. Your surgeon is gonna be so proud of himself. It's gonna be the best joint he's ever done. But the job now is for you, because everything that moves that joint has not been moving that joint for months, years, however long. So you are now rehabbing your connective tissue. So you've got ligaments, you've got tendons, you've got muscles. All those need to be toned, strengthened, and made more elastic. And that's what these exercises do. If you don't do that, the surgery adds a whole nother element of trauma and inflammation. Your body's trying to heal all that. And if you don't work past that with these range of motion exercises, then all those little layers that sit on top of each other in our skin and in our muscles and our tissues, they're all inflamed. And if you don't move them and work them, then all of that inflammation turns into scarring. And when the scarring happens, you have a frozen joint. So if you can't complete an exercise like it's directed, you need to say, hey, I'm having trouble with this exercise. Can you watch me do it? I can't do as many reps. And they might look at you and say, hey, you know what? That's a hard exercise for everybody. Let's try it this way and we can work the same muscle groups. So, okay, you have another plan. You're still moving forward. They might say, well, you know what? I think maybe we ought to call Dr. Craig. Not what everybody wants to hear, but you're still moving forward. So don't let anything slow you down without an explanation. And sometimes, if you know why you're experiencing certain things, it makes you it's a little bit easier to kind of grit your teeth and work on through it and get the job done. So make sure you communicate well with your physical therapy providers.
Typically, how long after surgery do you start outpatient?
Oh,
PT?
within days.
Several days, 1 day, 2 days?
It's usually probably within the week, within 5 days, you'll have an appointment set up. And when you're here, your therapy starts here immediately.
Right.
Yeah, right when you come home or come back to your room from
I just didn't
surgery.
know how soon after surgery they started that,
My surgery's
scheduling
on
that surgery.
Friday, and
Yeah,
they wanted me to come Monday, but it's Memorial Day, so I'm coming Tuesday.
yeah. But in the hospital, you'll start your therapy immediately. And then you'll be sent home with instructions to continue the exercises, and then you'll go to your therapy. So it's immediate. Yeah. All right. So remember, you can't drive for a little bit. 2 to 6 weeks, 2 to 4 weeks. Hips drive sooner than knees. Left knees drive sooner than right knees. Unless you work with the state under a CDL, you're not going to get a written release to drive. It's a safe judgment call for you, but you have to be realistic. If you're having to take every step with your walker, you're probably not ready to drive. If you're under the influence of pain medicine, it's illegal for you to be driving. If you are able to get in and out of your car comfortably, and you're able to move that joint quickly and efficiently enough to where you can respond in traffic situations and emergencies, you're probably going to be safe to drive. But don't expect that to happen within 2 to 4 weeks. If you have any questions about your joint's ability to be able to let you drive, bring that up to your surgeon, but he's not going to give you a release to drive. You just have to kind of make that judgment on your own. So, we've been showering with our surgical soap. Our house is ready. We've got